Preparing for a hair transplant, the important tips. Hi, I am Doctor Arvind Poswal from Dr. A's Clinic, Delhi, India. And today I'll talk about some important tips. Because people get confused. Someone says something, another person comes up with another list of things to do. So we'll talk about the most important things that you need to take care. Now we'll go over them one by one. Minoxidil lotion, vitamin E cream or vitamin E tablets and capsules, and aspirin. These three things, these three medicines or supplements or applicants, whatever you may call it, you have to stop them, and preferably stop them 3 days, and better still if you stop them 7 days before your procedure. Reason is very simple. All three of them lead to increased bleeding from your skin. So when we are doing a hair transplant, we don't want the place to be so messy that we can't do our work. So that is why we as doctors will always tell you, if you are using any of these medicines, so you stop them. Similarly, if you are a heart patient and you are taking anticoagulants, then check with your cardiologist or the doctor who is treating you. Tell him that we are going for a hair transplant. Take his permission first, because he may be giving you some medicines, and if they have some interaction with the medicines which we give you, that will be problematic for you. So if you want, we will tell you all the medicines that we are going to use. Just make sure that your cardiologist or your doctor also knows, and he can suggest any alternatives if he wants. Now, apart from that, there are two habits, of course. One is smoking and the other is alcohol. Both of them are very bad. Do you really expect a doctor to say that, okay, you keep on taking alcohol and come for your surgery? Or you keep on smoking and come for your surgery? Definitely not. So that is what I'll also do. I'll say, you are not supposed to smoke, you are not supposed to take excess alcohol before your procedure, while your procedure is going on, and at least a week after the procedure. Tobacco or smoking delays healing. It will spoil your epigenome also. It will weaken your stem cells also. Alcohol similarly has no benefit to your body. It will also weaken your body. It will weaken the stem cells. And if you want some good things, then do a bit of intermittent fasting before your procedure. Then we come to the next part. Many a times patients come and they have clean shaved their head. Please do not clean shave your head before you come to me for your procedure, because otherwise I do not come to know where you have miniaturized hair and where you have almost no hair. So if you want to keep your hair short, then also let them be at least 1 centimeter long before you come to me. When at the end of the procedure, if we need to cut all the hair short, then I will do that for you. Let's select a beautiful hairline for your hair transplant. Did you ever think, or did anyone ever ask you what hairline you want to go for? Or do you think only the doctor will decide that, okay, this is the hairline for you? So let me tell you something. Hair transplant is not about growing a few hair on top of your head. Many times I always ask my patient, what is hair transplant? And the first thing a person says, taking out hair from this place and putting it in this place. That is not hair transplant. That is only the surgery part or the science of hair transplant. The art of hair transplant is something different, and that is what I will talk about. When you are going for a hairline area, you have a lot of choices. At that time, you have to remember, when you are going for a transplant, you are going for a new image. It's an image makeover. You are looking for a new look. If you have a hairline that is really high up on your head, that will give you a different look. If you have a hairline which is really young, that will be a different look. A hairline can have a peak in center, or it can be a rounded hairline. So there are many different varieties in a hairline. Of course, we can adapt them to your face, but only in terms of whether we give you a high hairline or a young hairline. It has to be you who has to tell the doctor, doctor, I want this type of hairline. And if it is within reasonable limits, then I will be able to do that. So anytime anyone meets you in the future when you have got a hair transplant done, then they will always look at your hairline. That hairline will become your de facto identity. So think carefully, always think of a precise hairline so that you can tell to the doctor, this is what I want to go for. And then if it is not possible, then let me say that, okay, I cannot make you into a Shah Rukh Khan hairline. But if you have enough donor, then why not? So hair transplant is getting a beautiful makeover, a makeover that you want, a hairline that you want as a patient, not a hairline that the doctor has selected for you. So if you want a particular hairline type or a beautiful hairline design and you are finding it difficult for any doctor to agree to it, feel free to send me the pictures. I'll check out your donor and let you know if it is possible for you. Meanwhile, see a lot of results in our photo gallery results section. There you will find people, some of them have chosen high hairline. Some have chosen a very young hairline. So remember, it is always going to be your choice, not my choice. How high a hairline you want to go for or how many grafts you want to use. It's your head, your hair, your grafts and your hairline. Always remember, if you go for a young hairline, you will always need more grafts. A young hairline means we have to cover more area in this part, and this is a really long circumference. So it does take a lot of grafts, but that should not stop you. That is what your donor hair is for, to give you that magic image makeover that you want. I hope I made all these things clear. These are some special tips that you have to remember before your hair transplant. If your friend is going for a surgery, share this video with them also. And like this video, tell me what are the topics you want me to speak about and subscribe to our channel. Thank you.